entrepreneurs and professionals of Tampa Bay. Welcome to your hour for getting the information, the tools, and the connections for elevating your business. Welcome to Getting the Edge with Kelly Wilson. And here's your host, Kelly Wilson.
Welcome to Getting the Edge. I'm your host, Kelly Wilson. Thank you so much for being with us today. Getting the Edge is a product of Edge Business Community and Magazine. We are ultimately a multi-platform media company that is specifically designed to assist the small business community with gaining a voice, visibility, and influence, as well as connections in the community. So we're here with you each and every week, talking with business owners and community leaders to talk about their products and services, but we go a step beyond that. Our niche is sharing stories, and I'm a firm believer that we can learn a lot from each other. So that's what we're here to do with you. Check out edgebusinessmagazine.com. So excited! Our new issue launched recently. It was our New Year not-for-profit. If you have not already, go onto the website. You can subscribe and get your personal printed copy delivered directly to your home or office. So definitely check it out. We had a highlighted 10 plus not-for-profit organizations, as well as the dynamic individuals that lead them. So definitely check it out. You can also view the digital issue as well online. You can subscribe to our newsletters. We've got a lot of exciting things coming up this year. I can't believe we're already into February and March, and time just goes so fast. But we have a lot in the works. A brand new website launching the middle of March. We will be transforming into Edge Media Hub to really take our community-based approach and merge that with data and analytics, and to really take Edge as well as the community and all of our partners to the next level. So really excited about that. If you subscribe to our newsletters, you can keep updated with everything we've got going on. So again, really excited. Definitely get on there. Subscribe to the magazine right now. Really excited. Wanted to say thank you to our Edge Community and Magazine and Getting the Edge sponsors. Pilot Bank, who's one of our sponsors, as well as All Trust Insurance, your trusted employee benefits partner, as well as Tampa Bay Multimedia and WeBeam TV. If you're looking for a platform, if you're looking to have a voice, somewhere to share your story, definitely check out Tampa Bay Multimedia and get your own version of Getting the Edge. Getting the Edge, we've been really excited. We're in like our fourth or fifth year. I think 2015 is when we initially launched Getting the Edge, and started in the radio and then transitioned, as the amazing John Gaston would put it, into Pod Vision, where we are able to come to you with cameras as well as audio. So again, really excited to be with you today. Excited to talk with one of Edge's community partners, Omar Fuentes.
I'm excited.
Welcome, Omar.
Here. Thank you very much.
Thank you for being here. So Omar is president and CEO of Accelerated Health Benefits.
Yes, ma'am.
So tell us a little bit about that before I start drilling you on everything
absolutely.
else.
So Accelerated Health Benefits, or AHB, we're program managers. AHB,
okay.
That's the
acronym,
because it's a pretty long name at times. So when we're talking to people, AHB. So AHB is a program management company that designs and implements health benefit plans for employers, but we utilize specific strategies to actually cut out the insurance company, drive down costs, and improve quality. And then the reason why we actually categorize ourselves as program managers is because we actually manage the plans throughout the year and constantly update it to ensure that we're meeting the needs of the employers as well as the employees.
Okay, so explain that, let's dissect that a little bit more and explain it to, there are so many issues with health insurance and just everything that's gone on, and from an employer standpoint, what are the benefits, or who does this really target, or?
Yeah, so it does target actually a pretty large segment of the employer population, but like our target market is 75 employees and above. However, what we've noticed is that there is a smaller segment within the Tampa Bay area specifically of employers that are under 50 that still want to provide health benefits for their employees. So we actually have rolled out a program to do that. But to answer your question regarding of what is it that they're actually experiencing that they're wanting to utilize some of our strategies, is the fact is that it's just becoming so cost prohibitive for employers as well as the employees to offer health benefits, quality health benefits, right? So what we actually do is we want to provide control back to the employer so that the employees actually have benefits that they can actually utilize appropriately. So we utilize strategies like reference-based pricing, where we actually look at Medicare rates and then provide a reasonable reimbursement to providers and facilities above that, right? We utilize things like direct primary care, where they actually have access to primary care physicians whenever they want without co-pays or co-insurance or anything like that. And then we actually offer prescription drugs at a wholesale price versus a retail price.
So you eliminate the insurance company?
Yes, ma'am, completely. Yep. So so my background being the fact is that I've actually worked for the insurance companies for quite some time. I wanted to make a change within the system inside of the insurance company, realizing that the strategies that they utilize, while there are some benefits to them, they're actually enabling the issues that we experience on a daily basis. So I realized at that point that I needed to go out on my own, start my own company, have a couple of partners that experience the exact same things from different perspectives, though. We have a chief clinical officer and a chief information officer that have experience in their respective areas. But when we were talking for about a year before we actually formed the company, we saw that there were a lot of similarities from a clinical perspective and the technological perspective.
So are you able then to, eliminating the insurance company then, so are you partnering directly with the physicians and the
Yes.
hospitals?
Yep. So what we actually do is we do a direct contracting. We reach out to local hospitals, specialist groups, primary care groups, and we go to them directly and say, okay, listen, let's actually just negotiate between us the pricing so that we can create a network for the employer, not our own network, but for the employer themselves. So that's how we actually start working on designing the plans, customizing them specifically for the employers.
That's interesting. So, and then with the pharmacies as well then?
Yeah, so with the pharmacies, it's actually really, I think it's actually a pretty cool thing that what we do is we actually, again, bypass the insurance company, we actually localize the distribution of those prescription drugs. Meaning the fact is that we go to those local pharmacies and local hospitals to then take advantage of their pricing that they get directly from the pharmaceutical companies, and then distribute that to the employees or members as they're prescribed. So therefore, we're actually helping those local pharmacies and hospitals drive business to them. They participate in discounts and rebates, which they can pass down to the employers.
So like changing the whole model then
Yes.
of healthcare.
Yes.
Like what are they? A disruptor. Like
Yes.
you're that total entrepreneur, right? That disrupts the model that society has just had forever.
Yes, and I think that's the biggest issue. Is the fact is that we've been taught for so long that we have to operate within the system that has been provided to us. But there are so many issues within the system today that continue to just, again, enable those issues, right? So even things like in-network contracts. So we already know in the news right now that the current administration has passed some laws to now force transparency. But even in that law, there's still going to be a lot of confusion. So
Forcing transparency, meaning what?
So now what's required is the Trump administration has basically said to facilities and hospitals, you now have to disclose
cost.
the cost,
Okay.
or really the agreement between the insurance company and the facilities as to what you guys have agreed as to what the pricing is going to be for those services that you're going to provide to your patients. Now there's a lot of lawsuit against the HHS who governs that. Hospital groups and insurance companies don't want that disclosed. And that just really kind of shows that the fact is that the system itself is trying to hide a lot of things so that they can continue to charge what they
Well,
are.
the healthcare is like the only thing you can think of that you need at times, that you go in and they just take you and do whatever they need to do without really approval of anything, unless you're a minor or something, I guess, and they have to get approval for certain tests. But they don't say, this is what it's going to cost.
Right.
This is exactly what your bill is going to be, so do you accept? And you think, because I guess typically if we go into that situation, it's not really a choice, right? I mean, we have to pay, we have to take care, we have to handle whatever issues we're facing at the time, typically, especially if you're in an emergency room or something.
Right, they've taken control away from us, right? So if you want to go shopping for, look at Amazon for a prime example, right? You know that if you want to buy a laptop or a TV or just, a trinket, whatever it may be, you have an idea of what the cost is, right? And then you're looking for the quality, and then you're shopping around who's got the best pricing, right? So a lot of times getting something the cheapest is not always the best, right? But you at least have an idea or an understanding. In healthcare, you have no idea, right? So that's the reason why in-network contracts we believe is a problem. We actually eliminate that. We don't create, there is no in or out of network. You can see whoever you'd like.
Okay, I was just going to ask, so in-network meaning your primary care, that your physician that you're chosen, I guess,
Right.
or connected with.
Right, so what ends up happening is you provide them the insurance card and it shows on the back of it, oh, you're part of ABC Insurance Company. Yes, we're in network. The issue with that, though, is the fact is that I'll give you just a prime example. You're admitted into the hospital and you're there overnight and they provide you a toothbrush to brush your teeth the next morning, right? If they charge you $100 for a 50-cent toothbrush, but because you're in network, they knock it down 50%. So now you're paying $50 for a 50-cent toothbrush.
For a disposable toothbrush.
Right, did you really get a discount? You didn't. Now, you and I, when we're looking at our stores and purchasing jackets, blouse, jeans, whatever it may be, we get a 50% discount. We thought that we got a really, really great deal because we understand and know the price. In healthcare, we don't. So that in-network that provides a discount is really a misnomer, right? Because there is no foundational cost or pricing that we start with, and then we provide a reasonable reimbursement above that. We're not opposed at all to facilities and providers making money, right? We are, we do like capitalism, right? But not at the expense of someone's health, right? Not at the expense of the fact is that 60% of bankruptcies in the U.S. are attributed to medical bills. It is astronomical, and to be quite honest, asinine, that the fact is that is actually occurring in our system today, and we allow it. So what we want to do is, just like you said, we're disruptors. We want to break that mold and create a program that allows employers to take back control.
So you're, I guess, offering or have come up with another option versus Obamacare or just your basic insurance options, and then this would be kind of another option. So
100%, right. So we actually partner with a lot of, the other component is flexibility, right? So we've partnered with a lot of other experts within their respective fields, right? Within the area and actually across the country that allows us to embed certain types of benefits that are far more efficient, right? So I was just at the Synapse Summit, and one of the topics of conversation within healthcare was mental health. And the issue that we're having is that it's a huge barrier, a cost barrier for people to get the services they actually need within mental health. Well, we actually partnered with companies like Coke Notes that actually provide a nudge and provide a benefit ongoing to the members, right? So that they can actually have positive thinking, obtain the assistance that they actually really need. And then on top of that, we actually lower that cost barrier so that they can see their therapist, their psychiatrist, psychologist, whatever it may be that they actually need, versus encouraging them to take prescription drugs.
which is such an ongoing problem. I was watching a documentary the other day talking about just the opioid crisis and just everything going on with that, and the way, that's really gotten out of control.
Yeah, and that's the part, is the fact is that when you are operating within a system that continues to enable the issues that we continue to talk about, what ends up happening is that you see no alternative, right? And then the system is so massive, and the large players, which are the insurance companies, are forcing people into that system. So we have to try to break that train of thought, and our job is to educate employers, to educate employees and consumers, as well as providers and facilities, to let them know that there is actually a better way, much more efficient. We can pay claims or reimbursements in a much shorter period of time, and then allow employees to access the care that they so desperately need without breaking their backs.
Well, and healthcare has obviously changed so much over the last 10 plus years. I remember when my kids were young, you being able to go to the doctor and everything was covered. Whether,
Right.
if you had simple procedures or surgeries or different things that needed to be done, it was very little out of pocket. And now, that is, I know just from my daughter, she was having some gastro issues and ended up in the emergency room a couple times as we were trying to figure out what was wrong. And we have an insurance policy, and I couldn't believe the out-of-pocket expense that we then. And what I thought is funny in some of the policies we have, and I need to go back and evaluate them, but they didn't cover well visits.
That's shocking to me. Quite honest.
Yeah, well, seriously. So, in fact, she's gotten a little older now, but I mean, I think for affordability, everything. There's a lot of different reasons why you choose the plans that you do initially, but she needed, just vaccines that
Right.
we get, and the doctor didn't cover well visits, and we had to, budget plan, just to go in to get the vaccines that your child needs. I thought, okay, wow, it's really changed.
Right, it's a lot different. So I'm glad you brought up how it used to be. We're actually wanting to bring it back to that, right? Where it used to be that you had a direct relationship with your primary care physician, right? And they actually helped to navigate through the healthcare system, meaning the specialists and facilities, procedures and drugs, to kind of guide you along the way, because you or I, or unless you went to medical school, and I don't know, but
Unfortunately not.
So, I didn't either, but the thing is that they have the knowledge in order to direct us the right way. The issue, though, is the fact is that they're required now to spend 5 to 7 minutes with their patients while you're waiting 45 minutes in the lobby to be able to see them. We want to reverse that, to create now a relationship with providers and their patients, right? Allow them to have time to truly evaluate, ask the right questions, take a look at their healthcare data, and then execute on what the diagnosis is, as well as what the treatment is, right? But we actually, in all of our plans, we eliminate high deductible health plans. So you don't have a large deductible that you have to meet before the insurance actually even kicks in. We include co-pays, co-insurance, things like that. So there is sharing in the cost, but nowhere near what it is actually today. As well as the direct primary care component, it includes like basic things like vaccinations, right? Just basic wellness visits where you don't have to worry about, am I going to get balance billed for this office visit or for this treatment?
Yeah, you think preventative health or preventative treatments or vaccines or just even well visits that's like a no-brainer, I would think.
And that's the thing, though, is that a lot of people, what's happening is we've gotten to a place now where healthcare or our premiums or our insurance is actually discouraging us from taking care of ourselves, right? Versus staying on top of it, because it's just too costly.
Oh, I talk to people all the time that still don't have insurance. That
Right.
really, I've got a good friend of mine that works full time. She's corporate, but she is a single mom, and she's just, her employer, I think, offers some type of benefit or will help with some, but she still couldn't afford the plans they were offering.
And that's the thing, so I'm glad you bring that up, because some of the statistics now are that 54%, family plan premiums since 2009 have increased 54%. And deductibles have increased 160%. So while our wages for that same period of time have increased 24%. So it's outpacing inflation. So our wages are increasing, but it's being consumed by the cost of healthcare. So now, just as you were describing your friend, it's just a burden that she and many others just can no longer bear, right? So we want and need to completely reverse that.
Well, and the problem, her and I were on the phone the other night, and she wasn't feeling well, and she's having heart palpitations and different things, and it's scary because
Right.
she doesn't have insurance.
Yep.
And so there are some other ways she's found to get some tests and some different things, so we've kind of ruled out. But I was on the phone making her get a blood pressure cuff. She's not in the Tampa area, but anyway, just to try to monitor certain things that she could do on her own. But it shouldn't be that way. And I'm very much in my own bubble of Tampa and Edge, but in our community. But there are other areas where, is it Canada where healthcare is free? Like, where is it that healthcare is included in a part of?
Yeah, so Canada has that type of structure, right? Where you're a citizen, you actually are offered healthcare. There are actually other countries, in the world that have a very similar model. What I can honestly tell you, though, is that unfortunately, while the access to care or the barrier has been lowered and you have access to care, we still do have a phenomenal healthcare system And it's because of those healthcare professionals here in the United States that people actually travel to come here
Oh, I
to
agree.
get care. The issue, though, of the fact is that it's the cost, right? And then
we have great physicians,
They're
but we
phenomenal.
can't afford them.
No, and then they get trained and they go back to their countries as well, and you know, or they get dual citizenship and they're going back and forth doing all that they can to help out. So I think that the character of our healthcare professionals is there, that we want to be seen and they want to see us. Again, going back to talking to other medical professionals in a town hall, they're frustrated with the system as well, right? So we need to lower that cost barrier as well. But going back to even to the example of your friend, part of that is adopting technology like telehealth or telemedicine, right? Instead of making it a separate cost or a separate product line, which is how it's done today, embedded it in the plan itself so that it's already there. And now what ends up happening is you go to direct primary care physicians and they're saying, hey, listen, if there's an issue, call. And then we can actually chat over the phone or through a video chat.
But then they don't get the doctor visit. Like even like if you need, you know, anything, they always want you to come in and sit and have a doctor visit, which, you know, what does that run out of pocket?
Right. So that's a great point, because if we do things like the strategy of direct primary care, where you actually carve out primary care services, which are things like that, sickness, wellness, immunizations, right? Just little things, right? I've got a rash or whatever it may be. A lot of those things can literally be handled either over the phone or through a video chat without actually spending, you know, the time of getting in the car, making an appointment, going out to the you know, to your doctor, your provider, and then them seeing, nope, I know exactly what that is. This is what you need to do, you know, and then we'll do a follow-up within a week or something like that. But and as you well aware, is, you know, we're so busy in our day-to-day that a lot of times it's just not possible for us to do those things. But because of the system, it discourages us from going to see that doctor. So if you do direct primary care, where the primary care physician is getting a monthly fee for being your direct primary care doctor, right? You don't have to go in and pay that copay because they're obtaining that fee at a low subscription cost, basically. You can see that doctor whenever you want. You can actually call them whenever you need to. So they actually get that visit, so to speak, but they do it much more efficiently, and then now you actually get the care that you need in order to maintain your health.
So it's more like of a subscription plan than...
Right. Part of our program includes subscription for primary care. Then you have specialist facilities, things like that, where we're doing direct contracting, where we're doing things like reference-based pricing. And I know I'm throwing out a lot of verbiage that's probably...
Well, and that's why I'm just asking, because if I have the questions, I assume other people do too, that when we're not familiar, this isn't our realm of expertise.
Absolutely.
It's yours.
Yes.
So
Yes.
just going back, just so we can understand the benefits too of the differences between basic insurance, or, I mean, it took me a while to really understand the difference between of what Obamacare, which is, what is that?
Affordable
Care Act. And then really other insurance and what the differences were, and you know, when it's open market or whatever,
Right.
and then, you know, anyway, it's just so much to know, and when it's not your expertise,
Right. So
I mean, you really do need someone to help gauge you through
all the different nuances, right? Yeah.
Isn't there's a TV commercial, and I don't know who it's for, but they get into like the tractor, and then like the people get in the tractor with them, and I don't even know what it's for, but she's like, I'll take care of you. Maybe, I don't even know what it is. It's kind of funny, but so she's driving the tractor and plowing all the, anyway.
Right. So I think what's funny is that I actually think that a lot of people are actually doing those things, right? Where they are, the great news about us is the fact is that we are an end-to-end solution. So there's a lot of people that these strategies or programs are fragmented, right? So they're siloed. They're operating on their own, and they're trying to get to the employer, or they're trying to get to that individual. Yet what we're doing is trying to provide that end-to-end solution. So whether you need a surgery, you know, which hopefully that's the last solution, right? Great, we can provide that to you. If you're needing to see your primary care doctor, you know, we can provide that to you as well. Where the majority of insurance is actually offered by the employer, that's where our market is. We're actually even in development of trying to offer an individual solution as well for those who can't access.
Just going to ask that. Statistically, do you have any idea of how many Americans are uninsured?
Well, from what I saw before the Affordable Care Act, which is one of the reasons why they did it, it was literally upwards of like over 30%, right? So that's a pretty large segment of the population.
Before the
Affordable Care Act. I'd have to look to see what it is now, because it has offered the ability for people to obtain health care. The issue, though, is that a lot of insurance companies have actually pulled out of the exchanges to provide or to participate in the Affordable Care Act or those open marketplaces.
Well, and really, if you're making even, and I don't really know what average salaries are, but let's just saying 40,000, you don't I mean, you don't really qualify for that, any of the good, affordable programs in the Affordable Care Act, as ironic as that is, because that's a conversation I was just having and with some other people that were, those single mothers or those single families that are in, but still they're surviving financially, but not enough to afford. And I won't take us all down.
No, that's okay.
That's not necessarily what we're here. But there's just so many issues.
But I think that, again, I think it's a valid point to sit here and say that when you now have unnecessary layers and the waste that's out there today within healthcare, meaning the insurance companies are involved way too much. The government is now trying to force healthcare on people. They're actually dictating how insurance companies spend their money, things like that. While I understand there needs to be accountability, if you take a look at government programs, historically they don't operate as well as we had hoped, right? You look at Medicare and Medicaid. I mean, I have my own experiences with my father before he passed away on Medicare. Right? So if he would have received the treatment that he needed after his stroke, immediately after his stroke, versus when he was given 6 months to live, he would have and received the care that he needed at that point, right? If he would have had that care prior to, he would have actually been able to survive, we believe, a lot longer. If you take a look at the VA system, governed by the government, right? So what ends up happening is that there's a lot of people that have to, me being a veteran, I've experienced the VA system. Unfortunately, it's not as efficient as we would like it to be, right? So the access to care, again, kind of going back to the cost, maybe a little bit, maybe quite honestly, a lot more affordable, but then the way that the system is designed, you don't get the care that you need when you need it.
So you give up one for the other, or it's...
If you have all those unnecessary layers, right? So that's what we're trying to do, remove all of that. All we are is running the program. We help, we interview the employer, we interview the employees, we take a look at what they actually need, we design the plans, we present it to the employer, right? And then we say, okay, this is what the cost is going to be for that now. If we need to adjust certain things, it's not in a manner of where we're going to adjust them that's going to break the backs of the employees. A perfect example of that is I did some consulting work in the Midwest. And so I had to evaluate health benefit plans for employers and consulted with the employees, right, to help them make the appropriate choice for themselves based on what the employer was offering. But these folks were getting paid hourly, $15 an hour. Some of them working 2 jobs, every day. And what ended up happening was that their deductible, so that it could be affordable on a monthly basis, was about 25% of their annual income. For an individual, that is just, so it was like $12,000. And before the insurance actually even kicked in. And that was a strategy that they had utilized that I was not a part of that decision making. And it was just so difficult for me to actually verbalize to them how wrong this was, right? And then if they had a family on the plan, it doubled to $25,000. That is basically saying you have no insurance.
Right, so why pay a monthly fee for it and take it away from your net monthly income?
Exactly. So they were just basically working just so they could have access to care at some point in time in the future.
Right. If needed, because they're probably not going to go.
Right. They're not going to go.
Just for regular.
Right. And that was because of all those layers, all those, all the nuances of insurance today, that if we remove those, then we're actually able to provide a much more cost-effective solution for them. and a solution that they will utilize day in and day out.
Interesting.
Yes.
There's so many. Well, how many years now? Just in the last year?
So we actually we launched or we started in August of last year,
Okay.
right? But this was basically 5 years of development,
Right.
August to December of 2019, we put all the pieces together. In January 1 of this year, or I guess January 3rd to be technical, we officially launched and now are really on the path of just educating. So
Right.
I love platforms like this where we can actually talk about these issues, what the solutions are, and go from there. So
And it's really educating
Exactly.
the community, communities on exactly how you can benefit, and just, I guess, providing options.
Yeah.
We need options. One of the things I worry about or think about often, especially as cancer has obviously become so relevant,
Right.
and at some point, I don't know statistically what percentage of us actually pass on from natural causes anymore, but with the problems with healthcare, for so many people that don't, like, what happens if you're diagnosed with something without the plans? I mean, and what if you can't afford it? And I don't expect you to have that answer for me, but I'm just saying it's a problem. So I think providing other options and what your company's trying to do,
Yeah.
we need options.
Well, I think it's evaluating the different benefits within the plan, right? So unfortunately, I had to experience working within an insurance company that the plan structure just wasn't right, and a child had cancer, rare form of cancer, that went through all the normal treatments, and it didn't work. Once it hit to be experimental and investigational, the plan denied it. So they actually were hit with $1 million bill by the facilities and the providers and everything like that were actually doing that. And that was just basically, it wasn't necessarily the provider that said, well, you got to pay it, here you go. It was their billing department, because providers want to remove themselves
Right,
from billing and collecting. So they hire a billing and collecting company, and then their job is to try to basically get as much as they possibly can. So what ends up happening is they put the pressure on the patients, and then they're going back to the insurance company to the point where they had to actually sue their own insurance company to pay a portion of the claim, because they had already gone through all the different standard treatments, right? And that's where
There were no other options.
There were no
time.
other options, exactly. So it was to the point where we had to actually, the employer had to go and say, listen, this child may actually pass away soon if we don't provide her this last resort treatment. And it was actually already, the data had proven that once you, in her rare form of cancer, that it was actually like 30 or 40% successful, right? So she actually had a chance of survival if she received that treatment. So those are the things that we want to eliminate. That's the bureaucracy, the layers that are completely unnecessary, that we want to be able to do that. Additionally, what they don't tell you is that there are other products that are available to you to actually help supplement the cost of that, because things like cancer or dialysis, those things are extremely expensive, and we get that and understand that, but we need to be able to provide solutions, meaning either funding or money, or actually addressing the actual initial cost of that care, so that now we can all collectively together work to make it affordable.
Yeah, it's interesting how you think about, families that are sitting there together, and you're dealing with something like that, and, having to make decisions on, being able to have a life for your family and being able
Right.
to financially support them, or a treatment, or,
Absolutely.
and obviously there is no price we would not pay to take care of one of our loved ones.
Absolutely.
But yeah,
But if it becomes so expensive and so costly, what options do you have at that point, right? And we want to provide those options, right? Again, we manage them throughout the year to ensure that when we're looking at the plan and how the plan is actually performing, right? It's almost kind of like doing a financial plan or looking at stocks and saying, okay, how are your stocks performing? And we need to adjust here and there. We do the exact same thing on healthcare, because healthcare is not a template.
Right.
It's not a standard component that you can just fit any employer or employee into that box, right? We need to ensure that we're adjusting things appropriately. even to the point where if we're looking at a segment of a population or employers and saying, you know, these employers are utilizing X drug, right? And it's becoming costly. How can we get that drug cheaper for them or less expensive,
Right.
so they can continue to access it as long as it's appropriate for them?
I there's been a lot of controversy, I think, with diabetic drugs,
Yes.
right? And the cost of the insulin, and there's just so many issues to work through.
Right. When people actually have to make a choice now as to whether they feed their families or obtain insurance or purchase that drug because it's the only thing that's helping them right now, we have an inherent problem, and it shouldn't be that way.
That goes back to another, when I was talking about my friend that was dealing with some issues, and we had talked, and I'll just say, I've been on thyroid medicine for almost 20 years now, and I am fortunate. It's $20 a month,
Right.
with like the discount, but even regular price, it's not that expensive. And so as I'm talking through this with my friend, and we started talking, she's like, well, what if I need to be on medication for the rest of my life? And she immediately goes to think that it could be hundreds of dollars a month.
Right.
And I said, well, I mean, it could be 20.
It could be, right.
There are inexpensive and there are very expensive, medications, but it was deterring her even thinking that way from potentially going to the doctor and trying to diagnose what might
Exactly.
be wrong, with the idea immediately that it was going to be hundreds or $1,000, a monthly expense just for medication that she wasn't willing. Not willing.
or not able to
Right.
to pay, right, to fit
Not
that
unless she
bill.
started maxing out credit cards.
Right, exactly. And you say that, but a ton of people are doing
Yeah.
that, which is the reason why we have such large bankruptcies, medical bankruptcies in the U.S.
I mean, it didn't fit in her budget for her salary, so
Right.
then where else are you going to pull from is credit, and then
Absolutely.
over time.
And
Especially,
those are sorry.
no, I was gonna say, without an outlet then to pay it off. I mean, if you're
Yeah.
fixed into a salary that you expect every year,
Right.
where's that additional Christmas bonus, perhaps, your
Right.
tax refund?
Yep.
And then depending on where your brackets are, you may not have access to those.
Yeah,
So-
and that's the reason why, again, we categorize ourselves as program managers, only because of the fact is that we're taking a look at certain components like that, right? So how can we educate her or the employee to say, hey, there are alternatives, right? Additionally, we want to actually try to assist our members on chronic care management, right? So what can you actually do yourself that doesn't cost you anything versus something as simple as, going to the gym, eating healthy, understanding how you deal with stress, anxiety, those types of things. And those things are things, those are issues that we deal with on a daily basis at some, level, some greater than others. But we want to ensure that we're managing those those issues consistently versus allowing it to explode, and then now you're having to deal with all the symptoms, not the actual issue itself.
Right.
And not to say that, that you don't need medication for everything, but there was a doctor that actually even said that many of the issues, health issues that we deal with are reversible, and we can't do that. And we have to start focusing on that versus just completely depending on, medications or surgeries, things like that. If we can avoid those things, then great. But the healthcare, your plan has to allow for that versus denying things all the time.
Well, and by the time many people finally get diagnoses or go to a doctor, they've already, a lot of damage has been done to that point, to maybe where that's not the option anymore.
Right. So then they have to now maintain it or not allow it to get any worse.
Interesting.
Yeah. And again, even at that component, there are so many, when you look at healthcare, you have to take a look at the human,
Component
fact.
of it.
Right. Like the fact is that we're dealing with an individual who now has a health issue that is going to impact their life in some form or fashion. Now what ends up happening is they have to deal with either recovery or managing it, right? And then you add just the daily life of, paying my bills, dealing with my children, right? Making sure that they're happy and healthy, and then stress and anxiety on top of that, and so on and so forth. And we realize that when we actually can lower the barrier for accessing care, right, then that financial stress is removed.
Right, because it's a worry. It's something that as you want to care for your loved ones, whether it's any part of your family, even though nothing's wrong right now, I think we're all great at worrying and
Right.
hope, and just we always want to worry about what we can't control, and what might happen in the future. It's something that, especially if we care and
Right.
we love others, we're going to worry.
We want to
And
take
yeah,
care of them.
eliminating that worry would
Yeah.
be a great peace of mind
So
for
just think
many.
about it for a second. Like if you actually feel like, excuse me, one of our great worries is our children, right? We want to make sure that nothing wrong happens to them, right? Or nothing bad happens to them, especially health-wise. So when they're born and we realize that they're healthy, great, we're extremely, fortunate for that and happy, but then we want to keep them healthy as they get older. But one of the worries that we have is, what if something does happen and I have to go to the hospital? What then? I'm afraid of what the cost is going to be. With our programs and the way that we actually operate, you don't have to worry about it, right? Because we're eliminating a lot of the unknowns, right? We're now saying transparently, here's what the cost is going to be. But not only that,
And talking about that. So if this were to
100%.
happen,
Yes.
this would be kind of what we would expect.
going out to the employers and talking to them and saying, hey, this is what you have. This is what's available to you, right? And working with facilities and providers to say, let's be reasonable about the cost, right? Let's understand and start with a baseline. Today, what we deal with is what we call top-down pricing, meaning that facilities, unfortunately, are now on average charging 700% above Medicare rates, right? It's illegal to charge anything below that, so that's the baseline, and that's where we operate from. Non-for-profit facilities are charging 550% above Medicare. And a lot of times the reason why is because on the private insurance side, such chaos going on there that the facilities and providers aren't getting paid timely, and they're being denied those reimbursements because it is a cash business for them. So we understand that there's an impact to the medical professionals. So we want to ensure that all the players are actually getting the care that they need, so to speak, right? So
Right.
facilities and providers, they need that funding in order to continue to
To provide what they do.
Exactly. And us as consumers, we need to be able to have something that's affordable so that we can then go to those providers and facilities without worrying about what that balance bill is going to be, right? So if you are able to go to your primary care doctor and for a simple procedure, or not primary, so to a specialist for a simple procedure, you know that your copay is $20, and then you actually have what's called a 90% coinsurance, meaning the insurance or the plan is going to pay 90% of that. You're only billed the additional 10%, but you already know what that 10% is going to be.
Right.
So now you understand and know that the fact is that of what the cost is going to be for you. And then if it's a large cost for whatever reason, maybe it's a major procedure, having options to actually finance and pay it without actually being sent to collections immediately, those types of things. So
Right.
we're hoping that we can actually continue to educate people and let people know that there are options out there other than just the standard.
Yeah, well, I know we've got your website provided, and we'll make sure we share that information. And it just, I had flashbacks of, I'd mentioned my daughter having some of the gastro problems and us getting the bills in the mail, and
Being shocked.
yeah, well, hesitant to open it. We were scared initially, and then thinking, and it's her, she's 19 now, but even being worried, for, her dad and I on what would have to be covered,
Right.
or what would we going to ask her to take care of,
Absolutely.
So she was involved in the process, but it's just, it could be a lot easier. So,
It can be. And again, we believe that we have the solution to make it easier.
Yeah.
So we want people to be able to go see their doctor when they need to. We want them to be able to evaluate their options, right, as far as treatment. So, and not have to necessarily worry about where's the money going to come from.
Yeah.
Or are they actually getting quality care?
Well, I think just having those expectations handled initially and eliminating the unknown,
Right.
and just kind of knowing up front and just providing options. I think that's that helps.
I think that the last thing, another thing to mention is employers are constantly concerned about how much they have to set aside or pay for health care for their employees.
Right.
And it's a large component. On average, we're seeing employers having to spend 20 to 25% of the money that they make or their revenue spending towards health care. which is just a large,
Right. No,
you
it
know,
is.
cut to be able to set that aside. So if we're able to reduce that for them, give them control back, we truly believe that now that's an unknown or a barrier that we can eliminate for the employer
Right.
as well. But the other component is the standard system today. What it does is it says on a regular standard insurance plan, it says, okay, listen, you pay premiums to ABC Insurance Company, great. You manage your health for the employees well, so we send you a reimbursement. What ends up happening the following year, though, is that you still get an increase in your premiums. And we're seeing on average about a 15% increase in premiums year in and year out. So employers are wondering, well, if I do well, right, and I do everything I can to manage the health of our employees, right, which is a fiduciary responsibility of the employer regarding their health plan, why am I still getting an increase? We're wanting to completely eliminate that and say, listen, let's manage it so that we can continue to keep the cost down. There's some things that you're not going to be able to control. Someone, all of a sudden has to have a hip replacement, knee replacement, dialysis, whatever it may be, something significant. Yes, it's going to drive some cost increased, right? But then we can still manage it even from there versus just constantly expecting the same thing. Employers are opening up their mail, so to speak, and saying, oh, no, there goes my 15% increase again.
Yeah.
Let's go shop it out. Versus let's truly manage it and drive costs down and improve that quality.
Yeah. No, it sounds good and easily to understand, because sometimes I think it can be complex or just seem complicated, but through the conversation today, I think it's definitely helped. Well, you're obviously very passionate too about it as you start talking. Where are you originally from?
So I'm originally from New York City, Washington Heights, but my family is Dominican, right? So Hispanic, family, New York family. We're very much a tight-knit family, and we try to take care of each other, right? So whenever there's something wrong, we help each other out. And that's just kind of, I think, embedded in me to now say within my community, let's ensure that we do the same thing.
And retired Marine?
Marine Corps, yep.
So how many years?
So I actually did 8 years, and probably one of the best decisions I've made in my life. I was scared like crazy when I went in, came out a completely different individual, and that's something that never, ever leaves you. So now it's something that I'm constantly trying to be involved in within the veteran community, and then empowering other veterans to then make changes within their community and starting at home.
Tampa Bay
well.
has a very big military veteran community.
It does.
Yeah. So then what brought you to Tampa?
My father, he actually worked for, at the time it was Chase Manhattan Bank, which is now Chase, and he was an accountant for them. He actually worked 20 years to go to college, so to become an accountant, and finally got a good job at Chase, retired with them. But in that process, Chase was just opening up a location in Tampa. Nobody knew about it, of course, and moved to Carrollwood and went to high school here at Gaither.
Okay.
Yep, and then I joined the military after a couple of years of college, and then I always said I'd come back to Tampa, so I did.
So how many years did you grow up at all in the New York area?
A little bit, like when I was much younger, so maybe right around, middle school, came down here, and so I had already that New York attitude embedded in me, right? But then everybody around me and my family, we all kind of moved down here.
Okay.
We love the sunshine, less taxes, of course.
Right.
So we stayed and never looked back.
With the family, that's great that the
Right.
kind of the family moved together.
Yep, we did.
And then so military after high school, into the
Yes.
Marine Corps, and then what did you want to do? Like what was your plan after the military?
It's funny that you asked, just because I think it's a great question. So when I got out of the military, I thought at the time, unfortunately, I was in when September 11th happened, and right after that, the U.S. Marshals was hiring like crazy for air marshals. So I thought 100% that's what I was going to do. I had a friend of mine talk to me and say, "How about you use your head versus your back?" Because I was already hurting, and a lot of ailments having to deal with outside of after the military. So I said, sure. So I got into the financial field, loved being in business, and then my career just kind of morphed from helping individuals to employers, and then into employee benefits and healthcare.
And then you ended up working with an insurance company, which is
Yes.
kind of how you got into the behind the scenes of the
Yeah.
insurance world.
So I originally started in business development with them, right? Just trying to acquire as many clients, then managing a team of account managers that were acquiring and managing those clients on a daily basis. But the way that my mind operates is I have to understand what the process is, right? So that we understand what the nuances are, and then we can adjust accordingly for our clients. And then that's how I just got kind of sucked into organizational process improvement, project management, actually even oversaw special investigations unit where we investigated healthcare fraud.
Oh, interesting.
Right.
So did you always kind of have that innovation, that creativity aspect of an entrepreneur that ultimately ends up going into business for themselves?
I did. I think it was one of the reasons why I eventually understood and knew that kind of like my time was up in the military and needed to move on. But even within that, it was you had a job to do, and then it was up to you to do it. And quite honestly, I'm very proud to say that I excelled when they actually said, they always call you by your last name, Fuentes. This is what you got to do, get it done. Getting the right people involved and understanding what my weaknesses, are or were at the time, to then have a team surrounding me to support that, and then execute on our deliverables. And I just took that into the business world.
Well, it's so interesting. I've had the pleasure, and I say this often, of interviewing so many amazing people, including yourself, and just it's like pieces of a puzzle. All the
Right.
different points of our life that we go through that lead us ultimately to where we are now. But being able to utilize everything that you've learned throughout the way. What are some tips on bringing a team together? I mean, even as you look for partners with the business, or
Right.
just overall.
I think that's a phenomenal question. So when I had years ago thought about starting my own company, I knew I couldn't do it on my own, right? I knew I didn't have all the tools as confident as I believe I am. I knew that I needed to have some sort of support, and I was very strategic in identifying those types of people. So I think some of the things that I would tell people to kind of take away in evaluating things is, one, identify what your strengths are. And a lot of times they are things that we may not necessarily like to do, but they're things that we actually have to do.
Right.
Sharpen those skills, and then identify what is it that you actually, prefer someone else to do. Because the moment that you can identify somebody who likes doing, let's say, data analytics or something like that, right? Or working within an Excel spreadsheet. I'm good at it, but I don't like to do it on a
Right.
day-to-day basis. Bring somebody in on that. But don't discount sharpening your skills for a short period of time in doing that. That's kind of like, my train of thought and the way that I was raised was, you gotta earn your keep, you gotta earn your time, you gotta earn that title. So work through that and do the things that you may not necessarily want to do.
Well,
Then
often we don't have a choice.
it's true. We don't.
Right.
Especially when you're running, a business.
When you're starting on your own,
when you gotta
right.
have to do everything on your own. Then from there is just continue to remind yourself that, trying to do the very things that you actually like to do, but also encourage others, right, to explore their strengths and weaknesses and what they would prefer to do as well. So I kind of always thought when I led, even within the corporate world, was I want to train them so that they can go anywhere that they want, but treat them in a manner that they want to stay.
That's great. Yeah. Any favorite resources?
Just honestly reading, like just get like it's kind of odd, maybe self-help books or business books, things like that. Is I think you can always learn just by consuming something.
Do you have a favorite book?
So the one that I'm reading right now that I really actually like is Grit by Angela Duckworth.
We just really.
Really?
It's funny. Yeah, we were just talking about that. Didn't even know about. Had the pleasure of interviewing Vicky Sokolik of Starting Right Now, and I were having a conversation, and we got way off topic and just
Right.
started talking about how do you determine someone's ability to keep going.
Right.
And she's like, you need to read this book.
Oh,
Yeah.
it's a phenomenal book to do.
Yeah.
But it actually even helps you with your own, with evaluating your own ability to do things, and being a little bit more self-aware as to what your capabilities are and where you need to strengthen certain business muscles, so to
Yeah.
speak.
What is your definition of success?
That is, man.
We're
I think
about
we
down
need
to about
have- I
2
know.
minutes, so.
Definition of success, I think honestly is like, even though I started my own company, I actually believe I'm successful now. So whereas before I was miserable, unhappy, I wake up every morning, I get to be a disruptor in an industry that I actually believe is helpful to many people, or that I like to be a part of. And then I'm doing the right things for the right people. So, and if I can, earn a decent living from that,
Right.
I think I'm good to go.
Yeah, it's again so many things that we learn along the way, and
Right.
just bringing all those together. And it's so funny. I love asking people what their definition of success is, because it changes. I could ask you next month, and it
probably will
might be
change.
different. But I think that's interesting, because different. It's not, it's interesting. I've definitely learned to celebrate the small successes.
100%.
Because it and then we're so hard on ourselves typically that we achieve something, and then we're already. It's just we keep going further. You keep pushing yourself. So, anyway, I think learning to celebrate the small successes, every step is definitely worth celebrating. Thank you so much, Omar, for
Thank you
being
very
with
much for
us.
having me.
And Accelerated Health Benefits. We've had the website. We have the
Yes.
information on. Thank you for your service and your time
appreciate it.
in the
Thank you.
military.
It was
And
my
again,
pleasure.
thank you for providing options.
Well,
So
thank you for
good luck with everything.
Thank you for giving me a venue to speak here and to educate your viewers.
My pleasure. My pleasure. Well, definitely check out Edge Business Magazine. Go on, again, subscribe to the issue. Get your personal printed copy delivered directly to your home or office. Sign up for our newsletters and look for us every week as we're here with you, bringing great information, great stories. And again, it's not just about talking about products and services. It's
Right.
really interesting to learn about the people behind the
Yes.
businesses, and hopefully providing inspiration to those that are looking to pursue their own. So again, thank you so much for joining us today, and until next time, never stop dreaming.